Hello, everyone. It's Tuesday, March 29th. Forgive my dress just a little bit, and you may have to put up with me slurring a word or two because I've just had some extensive dental work this morning, and actually I had a wisdom tooth pulled, and so I'm gonna stumble all over myself a little bit here, but bear with me and thank you so much. But we've lost an additional 50 people since I was here the last time. You're going to hear some good news, but especially for these folks and their loved ones and their family, please keep them in your prayers. That's just all there is to it. The 6,740th death is a 76-year-old male from Greenbrier County. The 6,741st death, a 74-year-old male from Greenbrier County. The 6,742nd death, a 50-year-old male from Wayne County. The 6,743rd death, a 55-year-old male from Brooke County. The 6,744th death, an 83-year-old female from Putnam County. The 6,745th death, a 78-year-old male from Kanawha County. The 6,746th death, a 93-year-old female from Kanawha County. The 6,747th death, a 66-year-old male from Greenbrier County. The 6,748th death, a 62-year-old male from Kanawha County. The 6,749th death, a 55-year-old male from Raleigh County. The 6,750th death, a 96-year-old female from Tucker County. The 6,751st death, a 79-year-old male from Raleigh County. The 6,752nd death, an 88-year-old male from Cabell County. The 6,753rd death, a 41-year-old male from Putnam County. I hate that. The 6,754th death, a 93-year-old female from Summers County. The 6,755th death, a 74-year-old male from Ohio County. The 6,756th death, a 73-year-old male from Summers County. The 6,757th death, an 81-year-old male from Berkeley County. The 6,758th death, an 85-year-old female from McDowell County. The 6,759th death, a 67-year-old male from Cabell County. The 6,760th death, a 70-year-old male from Monongalia County. The 6,761st death, a 56-year-old male from Wetzel County. The 6,762nd death, a 91-year-old male from Cabell County. The 6,763rd death, a 76-year-old male from Cabell County. The 6,764th death, a 64-year-old female from Wyoming County. The 6,765th death, a 50-year-old female from Berkeley County. The 6,766th death, a 53-year-old female from Wayne County. The 6,767th death, a 99-year-old female from Raleigh County. Bless her heart. The 6,768th death, an 82-year-old male from Raleigh County. The 6,769th death, a 92-year-old male from Ohio County. The 6,770th death, a 91-year-old female from Raleigh County. The 6,771st death, a 92-year-old female from Harrison County. The 6,772nd death, a 74-year-old male from Webster County. The 6,773rd death, a 49-year-old male from Wyoming County. The 6,774th death, a 60-year-old female from Kanawha County. The 6,775th death, a 95-year-old male from Fayette County. The 6,776th death, an 88-year-old male from Mineral County. The 6,777th death, an 89-year-old female from Randolph County. The 6,778th death, a 74-year-old male from Roane County. The 6,779th death, an 82-year-old female from Jackson County. The 6,780th death, a 78-year-old male from Jackson County. The 6,781st death, a 72-year-old male from Kanawha County. The 6,782nd death, let me back up. The 6,781st death, a 72-year-old male from Kanawha County. The 6,782nd death, a 57-year-old female from Kanawha County. The 6,783rd death, a 79-year-old female from Harrison County. The 6,784th death in West Virginia is a 101-year-old male from Logan County. Thank you, sir, for all your wisdom. The 6,785th death, an 85-year-old male from Monroe County. The 6,786th death, a 67-year-old female from Barber County. The 6,787th death, an 82-year-old female from Summers County. The 6,788th death, an 87-year-old male from Morgan County. The 6,789th death is a 76-year-old female from Mercer County. The 6,790th death is an 84-year-old female from Ohio County. The 6,791st death is a 78-year-old male from Fayette County. The 6,792nd death is a 73-year-old male from Mercer County. The 6,793rd death is a 71-year-old female from McDowell County. The 6,794th death is a 52-year-old male from Wayne County. 6,794 great West Virginians we've lost. Please, please, please keep them in your prayers. Active cases, we have 376. New positive cases, we have 94 new positive cases. Our daily percent of positivity rate is at 2.42. Our cumulative continues to fall. It's at 8.24. We have recovered cases in West Virginia above 490,000. We have 155 people that are hospitalized, 50 in the ICU units, and 23 that are on a ventilator, and those are the number of COVID patients that we have hospitalized. Every single county in the state remains green. I don't know how it could be any better than that. Erica Balgus, is our director of our West Virginia Housing Development Fund, and she's joining us today to provide updates on these important and very important programs and everything. We got a clarification from Kenny Bass, and where I was, plowing a little bit in the wrong way and everything, but basically this was, in regard to our homeowner assistance program, and I welcome people to come up with, ideas and show us where we're maybe making a little bit of a mistake, from the standpoint of the homeowners can apply, it was a clarification in regard to the landlords in our rental assistance program. From the standpoint the landlords can apply, but with permission of the renters. And so I'm sure Erica will explain that better than myself, but two big programs where we can bring a lot of money into West Virginia, help a lot of folks and everything. We want you to take advantage of this, and we want you to take advantage of it right now, because the multiplier effect of those dollars, that's what I know, and I know absolutely will really help our state. So nevertheless, Erica, if you could come on and talk to us about it, it'd be really good.
Thank you, Governor. Let me start out and maybe clarify the question that Kenny Bass brought up about landlords. In the rental program, where we can help renters that have fallen behind in COVID, it's an applicant-based program. So applicants need to apply. There's a lot of information that needs to be collected about each applicant. However, once they do apply, their landlord is contacted, and the landlord also enters the portal and provides some information. So in a sense, they're both applying, but the applicant has to drive the application. Without the applicant's participation, the landlord's not going to get paid. But we need them to cooperate, and we need the landlords to be contacting their tenants to let them know the program is there and that that's somewhere they can go and get assistance. So everything that the governor has mentioned over the past few weeks, just getting the word out there to both landlords and tenants that that is available has been incredibly helpful. And we really appreciate that message getting out to our renter households. But also today, I want to talk about a brand new program that is now officially open to take applications, and that's the Homeowner Rescue Program. And similar to the renter program, this is for our homeowners to help them that have fallen behind in their housing costs due to the COVID pandemic. And this program can provide assistance with past due house payments up to $15,000, past due utilities up to $2,500. There's money for past due taxes and insurance of $5,000. internet assistance, and down payment and closing cost loans. And to help those that really need some extra guidance, you can get homebuyer counseling or homeowner counseling through this program. Now, there is an income limit of 150% of the area median income, but that's a fairly generous number. And of course, those limits are based on the county you live in and your household size. And that information is all on our website. And again, it's for homeowners. For your primary residence, that can be a single family home, a condo, a townhouse, a mobile home, or duplex. You've suffered a COVID hardship. And this program is for all homeowners, not just those that have an outstanding mortgage payment. Many West Virginians own their homes outright, but may have fallen behind on their taxes and insurance, and this program can help them. Like I said, applications are now open. You can apply on your computer, a tablet, smartphone, or you can request a paper application if that's what you need. I want to encourage everybody to go to our website and read about the program. It tells you all the qualifications, all the ways you can get help. It provides a list of the documents you might need to fill out your application. And once you have all those documents together, it might take you about 30 minutes to fill out the application. But if you have all your paperwork in order, that's going to smooth the process a good bit and help speed up the processing. Now, all of these applications, I want to make sure the expectations are clear. Every application is going to be reviewed by a live person. And once they go through the approval stage, if you're asking for mortgage assistance or help with your past due house payments, that information is going to be handed off to that bank or institution where you make your house payments. And that may take several weeks for that to get processed. In the meantime, if you've requested utility assistance or some other type of cost, those things will be moving forward. But we're just getting off the ground. We started applications yesterday, and we're starting to see some come in, and hope that everyone out there that is a homeowner will apply.
Erica, thank you so much. And, please take advantage from the standpoint of, if you'll just call us, our people will walk you through. I'll promise you the federal government wants you to qualify. They don't want you not to qualify. I'm a firm believer you'll never see Jim Justice's work on something to prove that it can't be done. There's no way. There's just no way. That's not in my DNA. If I'm going to work on something, I'm going to work to try to accomplish. I am not going to work on anything to try to come up and say, I can't do it. There's just no chance on the planet that I ever will work at anything so I can tell you I can't do it. I think that's wasted time. From the standpoint of our booster shots, please, please, please take heed and absolutely get that booster shot. Our vaccine distribution update numbers are a little teeny bit better. Now, I don't know if we announced this before, but we're at 90.2% of those 65 and older. We're now at 71.7% of the people that are 18 and older that have received at least one dose. And we're at 65.9% of those 5 and older that have received one dose. And that's really good. We just need to continue to follow through. And our booster shots now are up to right at 422,000. I think the last time we were here, they were, just under 420,000. We've picked up a couple thousand folks that have gotten their booster shot. Just answer yourself one question. And if you can answer this question, I don't think you can do it because there's no chance on the planet that I could ever do it. What's a life worth? What's one life worth? And none of us can identify that. There's no way. There's been, since the last time we were here, if I had the updated right numbers, there's been well over, almost 3,000, but well over 2,000 people that have gone in since the last time we were here and gotten their booster shot. What's the likelihood that some of those folks would have gotten this because their immunity by not having their booster shot is really waned? What's the likelihood that we would have lost somebody? Somebody of the people that came in and got their booster shot since the last time we were here. Maybe 2,000, maybe 3,000 got it. How many lives were saved just by us being here, continuing to beat the drum, absolutely telling people you got to get that booster shot, and lo and behold, we've got 2,000 to 3,000 more folks that have gotten it. Is it 1? Is it 10? Is it 20? Well, we don't know, do we? But absolutely, we do know this, that 1 is absolutely worth all of our efforts. And so that's what we're going to continue to do. The vaccine info line information on all the COVID stuff is on our website. I remind you about the free testing. We're down to 49 outbreaks in our long-term care facilities, none in the churches. We have 13 inmates and 3 staff in corrections. That's really good. You know, I remind you about giving blood. You know, if you've recovered from this, check with your physician, please. But if you've recovered, absolutely you ought to really consider. You know, I remind you about our Jump Start program that we absolutely just copied from Oklahoma. It's worked there. I'm sure it's working here. Our unemployment rate is at historic levels, and that's wonderful. And but we can make it better. You know, like I said, I'm not going to work at anything to just say, nope, can't do it. You know, we can make it better. So let's keep at it, and we'll change lives too. Some of those folks may have given up, may have absolutely said, well, there's nothing I can do, and I'm not going to be able to ever do anything, and lo and behold, they got them a job. They got them an incentive check of $1,500. They got them a job. They're on the job in excess of 8 weeks, and lo and behold, they like what they're doing. Their employers really appreciate them, and the net of the whole thing, they're on their way. You know, I don't know how it gets any better. Again, if we change a life, you know, I tell you over and over and over, you know, I coach for a reason. I coach to be with kids because kids need us. They need us, and I challenge all the legislatures to do stuff, do extra stuff to help, especially our kids. You know, absolutely without any question, when you're able to change a life, when you're able to save a life, which we're talking about right here, change a life and getting somebody back to work, or absolutely save a life with somebody getting a booster shot, you know, it's unbelievable, and it drives you. And while I tell myself, or tell a lot of people all the time, I'm the most impatient human being you've ever known. You know, I am really passionate about what I do because I care. I really, really care. And so at the end of the day, we just need more and more and more people to step up and really care. This state abounds with those folks. And lots of times, you know, you feel like, well, there's just nothing I can do. Well, there's always bunches you can do. Just get involved. Get involved in every way. Dr. Marsh told you about the new vaccine calculator. It's going to tell you when, you know, that you should be getting the updated, you know, booster shots. I've got a couple announcements here and everything. One of them is a lifelong friend of my family. His name is Charlie Wendell. And Charlie's doing incredible stuff all across the state. And I think this may be his 11th project or something like that he's doing in West Virginia. But yesterday we went to Fayetteville. You know, Fayetteville is a town right up on the mountain from, you know, from the incredible New River, the national park that we have there now. Absolutely a town that is just, you know, the neatest town that you could ever see. And it's beginning to really, really boom and really move in a way that, you know, is going to create more and more and more possibilities, industry, whatever it may be. Job opportunity, good job opportunities. Well, with that, Charlie Wendell is now doing a project over there. He's putting $15 million of his money in the project, and he's, you know, Charlie grew up in Fayetteville. You know, he went to Fayetteville Elementary School, where we were yesterday, inside the gymnasium and everything. You know, he is a national real estate developer, and Charlie absolutely is going to redo 3 former schoolhouses in Fayetteville and do incredible stuff with them. I mean, and it's just lots and lots of good stuff that's happening across West Virginia, and a lot of people stepping up. So Charlie, you're a great friend of my family. When I walked in and saw you, the thing that I'll never forget, the first thing you said is, you can't imagine how much time I spent with your dad. Well, how meaningful is that to me? And so welcome home again. You continue to do great projects. We even talked about another project that he's looking at doing in West Virginia, and good stuff, good stuff. Now, truth of the matter, so many deserve tons and tons of credit. Chelsea Ruby, our Secretary of Tourism, what an incredible job she's doing. Unbelievable. And with that, tourism is going like gangbusters, is it not? Well, as we continue, I have said so many times to Chelsea, we got it turned on now. I mean, the switch is turned on and we're rolling. But we're still in our infancy as our potential. This state is so beautiful, it's off the chart. The other day, through the DNR and all the parks folks and all the game wardens and all those, the law enforcement folks and everything, we through tourism, we announced doing something really special to the stream at Babcock State Park that goes all the way down through the canyon, all the way to New River, 5 miles. We're going to make it so unbelievably good to fish in, and absolutely it will be spectacular. And it will bring more and more and more people to this great state. Lots and lots of great stuff going on. Charlie, thank you. Thank you in every way for having confidence and wanting to come home. You could see it all over his face. While he probably made his riches and went in places all across this country doing so, he absolutely wants to come home, and he's doing it. He's truly putting his money where his mouth is, and so he's doing it right in West Virginia already, multiple projects. And this one will help, and we'll just go on and on. So best of luck in everything. We want to be supportive in every way, and Charlie, we thank you. Last thing I've got, and you know how much I love basketball. I'll tell you this right now. Glenville State University now has brought us the first national basketball championship. It's amazing. It's truly, absolutely amazing. You just think about it. National, we're not talking about kinda, national champions. And absolutely they did so, in a manner that is unbelievable. Let me just read just a couple things to you. They played Western Washington in the finals, and at halftime they were behind. And they came back and won the game 85-72. They just whitewashed them in the second half. And that was amazing, amazing, amazing. But in that, just think about just this. They scored 524 points in 6 games. That's right at 90-point average for 6 games. They broke the NCAA D2 Division II record, which stood for 18 years by 20 points. Their scoring was absolutely awesome, beyond belief. They averaged a victory margin of 25 points in the NCAA tournament. They finished 35-1, and I know Coach Stevens, I know Kim really, really well. She graduated from Parkersburg South. What an incredible job she's done. We're really proud of her. We're proud of all those great athletes and great kids. I'm sure that they're just the best of the best. We're going to have them down real soon. We just talked about it, and if they'll come down and have lunch at the mansion and everything so we can congratulate them and just tell them in person how great they've done and everything. Could not be more proud. So for the Lady Pioneers, yeah, I love it. I love it. Great job. Way to go. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. And following up with what the governor said, we are seeing the lowest numbers that we have seen since the downturn of the Delta variant. Excuse me. from Omicron now in West Virginia. And we are at this point for almost all of our counties at the low transmission rate, not only by our map, but also by the CDC guidelines. I think that while that's really wonderful to celebrate that good news, and certainly amazing what Glenville State University, the women's team did, we also know that there are a number of issues that are changing that we have gotten a bit of a foreshadowing from looking at Europe, particularly the United Kingdom, and saw that they also, through the middle and end part of February, were seeing the same reduction as we're seeing now in West Virginia. And then at the beginning of March, things picked up. And the BA2 variant really picked up for them and ended up increasing not only the number of cases, but also the number of hospitalizations and the number of deaths in the United Kingdom. And this really fell and burdened people that were older than 60 years old. And as we look at Israel, that also saw the BA2 variant really kick up and increase the number of cases that they saw. Israel, as one of the most aggressive vaccinating countries in the world, and really emerged as a world leader with Pfizer in that respect, published their data looking at the vaccinations of people over 60 years old, between 60 and 100 years old, that were given an additional booster, the second booster dose, 4 months or more after their previous booster dose. And they found that there was a 78% reduction in death in the people that got the fourth dose versus people that only got 3 doses and were greater than 4 months after that last booster dose. And this was with the BA2 variant of Omicron. So it's really important as we look at what happened today, where the FDA just gave the green light for us to give an additional booster dose. It looks like to Americans over 50 years old who are 4 months or greater from their last dose. Now, that's not quite official to go run to get your dose yet. The Centers for Disease Control, the Advisory Committee on Immunization Practices needs to follow, but that's anticipated to be done today. And the White House has already announced their commitment to doing that. And you'll remember that probably about a month to 2 months ago, we asked the White House if we could be the pilot state like Israel to be able to give that extra booster dose to West Virginians over 50 years old, because we were worried, because we were so early in vaccination and boosting, that there was the longest distance between the last booster and what we're seeing today, particularly as we're starting to see the Omicron BA2 variant start to grow in the US. So just like the United Kingdom, the Omicron BA2 variant is now the dominant variant of all new cases that are sequenced in the United States. We only have 12 cases in West Virginia, but we know that we will follow just like the rest of the country. As usual, we're a couple of weeks, 2 to 4 weeks behind many of the more populated parts of the country. And this variant really does have a predilection both for older people and for children. So important for us to get our kids vaccinated, but really important as we anticipate the CDC will give their okay for us to update the vaccine calculator the governor talked about, which is available for all West Virginians. And certainly we hope people can use that at vaccinate.wv.gov, I believe is the website. And we will update that as the recommendations come out of the CDC. But we know that 1 out of 70 over 65-year-olds in this country have died of COVID-19, and 3/4 of all the deaths that we've seen through this whole pandemic, 976,000 in the United States, have been people over 65. So really important when these guidelines come to fruition, which should happen today, I believe, that people in that age category, and also anybody who's over 12 who is immunocompromised, who is 4 months or greater from their last booster shot, will also be eligible for an additional booster. really important opportunity for us to protect our most vulnerable, our wisest, protect our wisdom, as the governor has said, and prepare West Virginia so that we don't see more tragedies happen from what will likely be another round of challenge for us with COVID-19. And the level of severity of that challenge will be most clearly predicted by the numbers of people that we can get with additional booster shots as those become available. Thank you very much.
All right, thank you, Dr. Marsh. Secretary Bill Crouch, Dr. Ayn Amjad, and of course, Erica Bogus, Director of the Housing Development Fund, are joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Stephen Adams with Ogden Newspapers.
Yeah, this is Steve Adams of Ogden Newspapers. I feel like I ask this every 6 months or so when I get on here, but our state of emergency, every state around us except for Kentucky has rescinded or their state of emergency, or their state of emergency has expired. I think Virginia's just expired March 22nd. Kentucky's is set to expire April 14th unless they extend it. Where do we stand on that? What are we looking at as a timeline for taking that off? Thank you.
Well, Stephen, let me just say this, that we continue. I could give you a somewhat of a political answer. Say we continue to look, at the state of emergency and the benefits, yay and nay, to stay in a state of emergency. Not, we do it all the time. There's one thing that's really, really, really important is we need to be able to draw down 100% of the federal government's funding toward West Virginia. And I sure don't want to lose those dollars, because those dollars are phenomenally important to our state. And our state, has a great opportunity, as we're already doing, to capitalize on those dollars and then manage them the correct way and do good stuff with them. So we continue to look at the state of emergency. I don't think it's hurt us in any way to remain and be in the state of emergency, but absolutely, without any question, we don't want to lose any of those dollars. And so we're going to continue to watch it, and when we can, we're going to remove it. But nevertheless, that's the best answer I can give you.
All right, thank you, Stephen. Next to Paul Mullen with WCBC.
Good to be with you all. I'd like to talk to Dr. Marsh a little bit about the concept of herd immunity. We kind of put that on the shelf a while back, that it may or may not exist. Does it exist? Are we there yet? I know that we should get booster shots and all that, but what about herd immunity? Is West Virginia at a point in vaccination and exposure that we are there? Thank you.
Dr. Marsh, before you go, Paul, I love you with all my soul. Paul, I just read 50 more people that died. 50 more. I do believe that there's really something to the herd immunity, and but the very reason that I'm here reading the names and going through and urging people to go get their booster shots and everything else is because we can cut this number way down. 50 people, Paul, 50 more people in our state we've lost. And it's tragic beyond belief. A whole state's green. The entire state's green. Sure, there's herd immunity. Whole state's green, herd immunity, 50 people died. To me, we can do something about this. And the more people we get vaccinated, the more people then we'll have in herd immunity. And, not from that, but we will have more of a herd immunity as we go forward. More people that are vaccinated, absolutely less people will die. So Dr. Marsh, please go.
No, Governor, I think that you've touched it well. And Paul, herd immunity is a theory from looking at at livestock, at cattle. And it's really about how much immunity needs to be maintained versus with the herd to prevent the spread of an infection, like firewalls stopping a fire from spreading. And I think that the challenge with that term related to any infectious process like COVID is the fact that the COVID virus is constantly adapting and changing and becoming more capable of infecting people. And so really what you're asking is, what is the amount of immunity that we need across our population to prevent the virus from spreading in the rapid pandemic way that it has been? And the truth is that this is always a relative, relationship between the virulence, the power, the infectivity of the virus, and the potency of our immune system. And we know that the immune system starts to wane from potency the longer you're out from your last vaccine, or the longer you're out from having recovered from COVID-19. And we know the virus continues to get stronger. The Omicron BA.2 variant is about 30 to 50% more infectious than the BA.1 or the BA.11 variant, which is what we saw in the United States before. So the virus continues to get stronger. So the truth, as the governor said, is that the issue of herd immunity is more of a theoretical one. But the key is we know that an additional vaccine in people who are 4 months after the last vaccine who are over 60 years old, and we know in West Virginia that number is really 50 years old and over, is going to save a lot of lives. And that's the reason why we're so committed and so focused at trying to move that message and move those capabilities forward so that we get more people vaccinated and boosted again, as would be appropriate after the CDC also makes their guidance, so that as we see Omicron, the BA.2 variant, come to West Virginia, we will be protecting our most vulnerable people from hospitalization and death from that particular new variant that will come through almost certainly in the next several weeks.
All right, thank you, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Dr. Marsh, given the today's news about our second booster for those 60 and older, do you think a second booster for all adults is inevitable, given the fact that we've been through this, authorization process multiple times now? Is that what folks can expect next?
Doc, please.
Thanks, Governor. Thank you, Charles. It's interesting, Charles, that the Israel, that's really been a leader for us as far as vaccinations, they demonstrated that there, as I mentioned earlier, that there's a 78% reduction in death from the BA.2 variant of Omicron, of COVID-19, the Omicron variant, when people got an extra booster dose, if they were 4 months or greater after their last one. But there's also a study in healthcare workers in Israel getting a fourth dose, and it did not demonstrate as much protection for that population because the third dose was still working pretty well. So I do think it's inevitable that everybody will get another booster dose at some point or be offered that. But whether that booster dose is the same vaccine that we're talking about today, or one that may be more directed against Omicron or whatever the variant is at that point, I'm not clear on. But I think that the commitment to vaccinate Americans over 50 years old is very wise. And that's really where the data is. And so I think we'll see more information coming out. But right now, there doesn't seem to be the same benefit to give people under 50 unless they are immunocompromised an additional booster dose 4 months after their last booster dose, as much as we're seeing with that population over 50.
All right, thank you, Charles. Next, we'll go to Katie Ree with WDVM.
Hi, Governor. Hi, panel. So I have a two set of questions. The first one is, will there be a second round of vaccine sweepstakes, obviously with the approval of that fourth dose of Pfizer and Moderna? But now talking about that fourth dose of Pfizer and Moderna, what's the guidance for people who've received the Johnson & Johnson vaccine and then the booster from that?
Okay, Dr. Marsh, you're getting a lot of action today. Maybe Dr. Amjad can help you, but go to it.
All right, let me start, Ein, and then I'll ask for your comments as well. Katie, it's not clear at this point exactly how the J&J vaccine will be handled. I would presume that CDC and FDA will give guidance in some respect related to Johnson & Johnson. But right now, the recommendation is for Pfizer and Moderna, at least as the FDA approved those. You know, one thing that's really interesting about Johnson & Johnson is initially we looked at that as perhaps a less effective vaccine when you looked at the immediate data from Pfizer and Moderna versus Johnson & Johnson. And then there was the issue with blood clots in some women, which is a very rare effect of the Johnson & Johnson vaccine, but really caused the vaccine to be used much less frequently. But through the Omicron variant, what we've seen is Johnson & Johnson seems to have a much longer potency, even though it may not have been as good immediately as Moderna or Pfizer. It seems to have a much more prolonged function, and the potency has been maintained. So it's actually done much better than I think many people would have predicted. But right now, for the next booster, as far as I've read, there's really only that potential approval from FDA, and CDC's following up today with Pfizer, Moderna. More to people should stay tuned for the Johnson & Johnson. I
don't have anything else to add to that, Clay. Thanks.
All right, thank you, Katie. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, everyone, and I appreciate all the guidance on the second booster shot, since I sadly have the top 6 highest risk factors. I've already made my appointments at 2 o'clock on Friday. I'm getting my second booster. My question today has nothing to do with COVID. Governor, you may be aware of this. Now one of the Republican leaders in the House of Delegates, Delegate John Hardy, a Republican of Berkeley County, the assistant minority whip, is now proposing a gas tax rebate instead of a gas tax holiday in West Virginia. Obviously, he's in Berkeley County, and you can just drive across the border into Maryland, and gas is 36 cents a gallon cheaper. So now that we have Republican leadership joining with Democratic leadership in the House to try to do something to give people some relief on the gas tax, might you call them into a special session and see if they can work this out and get something that's comparable to what Maryland did in dropping the gas tax there for 30 days? Some states, Virginia is still talking about 90 days. But where do you stand now on doing something to reduce the gas tax now that some of the Republican leadership is putting its voice out there as well?
Well, Mark, where I'm at is real simple. I really believe wholeheartedly, even though the Democrats ran out and, jumped up on their soapbox and started, beating their chest and everything in regard to this. I really believe the Republicans have, we all stand in the same boat. We'd love to be able to come up with some mechanism to give people, some level of relief. At the end of the day, it's going to take the legislature coming together to be able to accomplish this and everything. And right now, with all the different things that are going on, from the standpoint of repairing our roads and everything else that these dollars basically go for and everything, from my standpoint where I stand, is I stand wholeheartedly on one position. If the legislature comes to me and says, this is what we want to do, I'll be all in. But there are so many ramifications. We do not need people grandstanding knowing there's an election in just a little while. At the end of the day, we want to continue to do the smart things in West Virginia for all of our people and everything. And so from my standpoint, just like anybody, just like you, Mark, and everybody else, there is a lot of ramifications here, but I'd be 100% all in, if everybody got in line and said, this is exactly what we want to do. The thing that we got to realize, though, is absolutely without any question, these dollars, are going to amount to about, I don't know, 30 or 40 million dollars a month, and that 30 or 40 million dollars a month is going to repair our roads. And at the same time, nobody in the world would want us to pay a little less at the pump and everything than me. But the driver wholeheartedly behind this whole thing is this. We're not talking about, we're at $5 gasoline or $4.50 gasoline and everything. Well, the taxes are 30 some cents and everything. But if at the end of the day, what's driving the whole thing is, let's just call it like it is. What's driving the whole thing is weakness from D.C. No federal energy policy, no absolute energy independence in our country. We ran out and absolutely made a fool of ourselves, and that's what we did. Like it or not like it, that is exactly what's happened. Now, you got a lot of people out there capitalizing on this, and a lot of people that are really hurting. There's no question whatsoever about that. You know where I stand? I don't think that we can, surely to goodness the federal government can get their act together at some point in time. But you know exactly where I stand now, and I don't think I can be more clear than what I've told you.
All right, thank you, Mark. Next to Bob Aaron with WCHS and Fox 11. Bob, your Zoom may be muted.
Bob, let me just say this real quick, and I really mean this. You talk about a man stuck on. There's a man that has grown a little older, but acts surely like he's not grown a lot older. That man is amazing what he does and how hard he works, and so Bob, we couldn't get you there, but I got a lot of respect for you.
Bob, are you on now? Yeah, it looks like we're not getting the audio, so I apologize. Last today, we'll go to Randy Yohe with West Virginia Public Broadcasting.
Thank you. Yeah, I'm the new government reporter for West Virginia Public Broadcasting, and I'm glad that Bob is a few years older than me. Governor, I just want to follow up on Mark's question one time. So you have not been asked by the Democratic legislators to hold a special session for their proposed gas tax holiday, and you said that it was be up to them, legally responsible. So just will you call a special session to see if that can be done?
I think they wrote a letter. I have not personally been contacted by the leaders of the Democratic Party in any way. I do not believe that there's an agreement on this at this point in time between the Democrats and the Republicans and everything, and I do not believe that all the Democrats are in support of this as well. Now, all that being said, that isn't a challenge. That's not a challenge to everybody to start running to the hills and trying to prove something. At the end of the day, where I stand is I have been in contact with the legislative leadership. From the standpoint, I have had some minimal discussions. With the leadership in the Senate, President Blair, and but really and truly, this to me is election time politics, and I know our people are hurting, and I know that it would help to some degree, and from that standpoint, I'm all in. But at the same time, it takes a lot more than just somebody going out and running through the streets screaming fire or whatever.
All right, thanks, Randy. Governor, I'll turn it back to you.
Okay, I've made several notes today, and I'll go through them real quick with you and everything. And I want, I surely would really appreciate the media staying with me just 1 second on this, because Dr. Marsh brought out some things that are amazing. you know, our people that are 65 and older, they got a lot of wisdom and everything, and they see the danger that's going on out there. And for the most part, 90.2% of them have received one vaccination, and that was really good. Most of them have followed up and gotten their second vaccination. There's still several that don't have their booster shot, and now the fourth shot is being maybe offered up to those folks. Now, just stay with me. Dr. Marsh just said, now you may think, no, I'm not going to get this. All the counties are green. Justice says the numbers are better. I'm home free. Ask yourself one question. Ask yourself, please, this question. Who do you know? Who do you know that got the vaccine and died? Who do you know? And imagine this statistic. 1 out of every 70 of you, me included, 1 out of every 70 of us over 65, 1 out of every 70 of you or us have died in this country, have died from this. Now, are you willing to really take that chance? Are you really willing to take that chance? We're not talking about a long shot. We're talking about 1 out of 70 of you. That's all there is to it. You need to get that booster shot. You need to get your fourth vaccine. Absolutely, you know, you're important to us. You know, and all of you out there that can help your grandma or your neighbor or whomever to get that shot, they need to do it. Ask yourself over and over, who do I know? Who do I know that got this vaccine and got that shot and died? I don't know of anybody. You know, with all that being said, how many do I know that we're saving their lives by being vaccinated? It's off the chart. It is totally off the chart. The other thing I'd like to say to you is just this. We lost 50 people since the last time we were here. 50 people died. And it's become almost old hat, hasn't it? Well, you know, we got 50 more, we got 88 more, we got 27 more, we got 110 more. What would we do? How would we feel all across this state if an airliner went down? You know, a lot of the jets that fly into our airports are 50-passenger jets, and the airliner went down, killed everybody. How would we feel? I mean, absolutely would tear our guts out, wouldn't it? Over and over and over, it would tear our guts out for days and days and days and days. And if there was some way we could have prevented it, we would love beyond all comprehension to go back and try to prevent it. Well, there's a way to prevent this. That airliner doesn't have to keep going down every day. Absolutely, we've got to get you vaccinated, especially if you're over 50. We've got to get you vaccinated. The other thing I'd say to you is just this. We've lost 6,794 West Virginians. 6,794. Now, that line is long, long line. A long, long line of body bags. But can you just imagine this? And Kenny Bass brought this out to us, and he's kind of keeping a tab on this and everything. That's if we went down in Nitro and every single person in Nitro died. All of them. Everybody died. It's less than 6,794. It's unbelievable. You know, the question was asked, well, you know, as far as incentivizing people to get their vaccines and whatever like that, as we go into this fourth shot and fourth booster, well, we've been out over and over multiple times and do it for baby dog stuff and everything. If we gotta drag baby dog back out there or whatever we got to do, I'll do it. I'll do it in a second, because I truly know that you can't identify how much a life is worth, and I truly know that we're saving lives. So nevertheless, I would end by just saying just a couple of things. You know, you've listened to me, and you've helped me pull the rope, and I've told you the truth all the way through everything. I need you now too. I need you to keep helping me pull the rope. I need you absolutely to take that fourth dose when it's available to you. I need you absolutely to get your booster shot. We can stop this now. We're all green counties. We have herd immunity to some degree. We can shut this thing down now. I need you. I really need you to keep pulling the rope. And the last thing I tell you is this, this morning real early, it's hard to believe you're 70 years old and you're getting a wisdom tooth pulled, but that tooth has been with me a long time. And, but it was cracked and it has a few little issues and everything. And I'm going to have this hip surgery, and the people, the orthopedic people at WVU said, anything that you've got dental-wise needs to be fixed and needs to be fixed right now. So, from the standpoint of taking care of that, I did that this morning. I'd be lying to you if I didn't tell you it hurts like a dickens. But we'll get through that real quick, and we'll get this hip replacement and keep on going. You see, at the end of the day, that's what we all try to do. A lot of people are avoiding certain things that you just got to do. Whether they be checkups or, anything in the world that is really a chronic problem that's been bothering you, try to halfway address it. I've got all kinds of shortcomings, eat too much. Baby dog and I are on the same dietary program, and all those kind of things. But at the same time, I try as best I can to do what I think is best. But just remember the last thing, I love you. I really love you, and I want nothing but goodness for all of you. So thank you so much. That's all I've got.